1. How H5N1 bird flu devastates dairy cows. Symptoms, risks, and economic toll. 2. Breakthrough universal influenza vaccine for cattle, protecting against H5N1. 3. Bird flu chaos. How calves spread H5N1 to U.S. dairy cows. 1. How H5N1 bird flu devastates dairy cows. Symptoms, risks, and economic toll. Imagine losing nearly 75% of your income overnight, with no guarantee of recovery. That's the reality dairy farmers face when highly pathogenic avian influenza, HPAI, H5N1 infects their cows. This virus, a relentless threat to poultry since 1996, has now crossed the species barrier, causing unprecedented losses in dairy herds. It's not just about the cows dying or being culled, it's about the milk drying up, the economy collapsing, and the ripple effects that touch every corner of the industry. But here's where it gets controversial. Some experts argue that the true cost of HPAI H5N1 may be even higher than we think, as it silently infects more cows than we realize. And this is the part most people miss. Could our focus on clinical cases be masking a much larger, subclinical epidemic? Join the conversation and share your thoughts. Do you think we are underestimating the true impact of this virus on our dairy farms? 2. Breakthrough universal influenza vaccine for cattle, protecting against H5N1. Imagine a world where cattle are protected from deadly flu viruses, no matter how they mutate. That's the future we are working towards. But here's where it gets controversial. Even though cases of avian influenza, H5N1, in U.S. dairy cattle have been on the decline, sporadic detections continue to be reported. The most recent case was confirmed in California on July 11, 2025, affecting yet another dairy herd. With over 1075 herds across 17 states already testing positive, this virus is proving to be a persistent threat to our agricultural systems. The stakes are high, says Miriam Martin, Ph.D., Scientific Program Manager at the Foundation for Food and Agriculture Research, FFAR. This rapid funding is providing the U.S. dairy industry with urgently needed tools to protect animal health, farmers' livelihoods, and consumers' wallets. The team at Purdue is leveraging previous research on influenza A viruses and a bovine adenoviral vaccine platform to develop a universal influenza vaccine for cattle. This vaccine is expected to be effective not just against H5N1, but also against future mutations of the virus. Think of this universal vaccine as a shield, explains Suresh K. Mittal, DVM, Ph.D., Distinguished Professor of Virology at Purdue. We can use it for any agent and for any host. That's the beauty of this vector system. The research team will also explore the best method for administering the vaccine, investigating both intranasal and intramuscular delivery routes. This isn't the first time FFAR has funded research on an H5N1 vaccine. Earlier this year, the foundation awarded a grant to Genvax Technologies, an animal vaccine company based in Iowa. Genvax is using the funds to develop an H5N1 vaccine for cattle and is also exploring diagnostic tools to differentiate between infected and vaccinated cattle. This is a crucial step towards ensuring that our vaccination efforts are effective and that we can accurately monitor the spread of the virus. As we continue to work towards a world where cattle are protected from deadly flu viruses, it's worth asking, what other measures can we take to safeguard our food supply and agricultural systems? What role do you think technology should play in this effort? Let us know your thoughts in the comments below. 3. Bird flu chaos. How calves spread H5N1 to U.S. dairy cows. Calves drinking infected milk have unleashed viral chaos across America's dairy farms, a revelation exposing a hidden transmission pathway for bird flu. Scientists now confirm that nursing calves actively spread the H5N1 virus to cows through mouth-to-teat contact, turning routine farming behaviors into superspreader events. Here's the shocking truth. Calves' self-nursing and mutual nursing habits allow the virus to jump from their saliva directly into mammary glands during feeding, bypassing respiratory routes entirely. But this discovery is just the beginning. What follows could reshape our entire approach to zoonotic threats. Over 1,070 dairy farms across 17 U.S. states are battling outbreaks, with H5N1 killing up to 10% of infected cattle and contaminating 25% of retail milk samples. 41 farm workers have contracted the virus, underscoring the terrifying gap in our defenses. Now for the twist scientists never saw coming: bovine mouths are viral factories. Rich in sialic acid receptors, molecular doorways for infection, they let the virus replicate explosively after calves consume tainted feed or water. When those same calves nurse, they inject the pathogen straight into mammary tissue. Here's where it gets revolutionary: 2 vaccines, an H5N1 inactivated formula, and a hemagglutinin-based DNA shot, just demonstrated total protection in trials, even against high-dose exposure. Yet this breakthrough ignites controversy. Why weren't these developed sooner? And can cash-strapped farms afford large-scale vaccination? Critics argue profit motives delayed action while herds burned. Meanwhile, mutual nursing, once seen as harmless, now demands urgent policy reform. Should farms segregate calves? Ban shared nursing? The dairy industry faces brutal trade-offs between animal welfare and contagion control. For global health, the stakes couldn't be higher. This study isn't just about U.S. cows, it's a blueprint for halting zoonotic spillover worldwide. Vaccination programs could safeguard milk supplies, but surveillance and biosecurity are equally critical. Yet one question haunts researchers: if mouth-to-teat transmission exists here, could it fuel outbreaks in goats, sheep, or other mammals? We are teetering on the edge of a pandemic tipping point, and silence isn't an option. What's your take? Should governments mandate vaccines, or does personal farm autonomy outweigh collective safety?